I'm David, this is Perform, and today probably the most important lesson that I teach, the one-act play, getting more dentistry on your schedule. Many times when I speak to groups, either large groups or individual practices, I say to the group as a whole, how are you going to grow the practice? And they kind of get uncomfortable and they know what these lofty goals are. The doctor has shown them the picture of the house that he wants to buy or the trip that he wants to take, which is not very motivating, by the way. But they get kind of uncomfortable, and finally someone kind of says, well, if he'll diagnose it, we'll do it. And that's typically how most teams view their role in growing a practice, right? Certainly marketing or doing community events or patient referrals, all that stuff is great. But how do we actually involve the staff in supporting the doctor? Because the typical current model of, well, if he'll diagnose it, we're more than happy to do it, really puts an unfair burden on the practice owner and the dentist, obviously, who are the same thing. It's really unfair to look at one guy and say, it's all up to you, it's up to your shoulders. You have to find the dentistry, you have to convince the patient, you have to do the dentistry, and all the while manage all the business aspects of the practice. So we have lots of lessons that we've done and lots of lessons to come about how to make that part of it easier. But what I really want to focus on today is, again, one of the most impactful and important lessons that I teach, which is the one-act play. So rather than waiting for the dentist to diagnose it, I'm really focused on the one-act play, which typically occurs in the hygiene visit. And the one-act play is a structured, designed system to involve the patient with the hygienist, with the doctor, and have all three of them dance together in a conversation that flows and results in greater patient acceptance and certainly greater patient knowledge. And it looks a little bit like this. At the top of the hour, the hygienist should do any x-rays that are needed, any probing depths if they're needed, and if they need help to do that, I highly recommend having an RDA or an assistant come and help the hygienist. We ask a lot of our hygienists, and they typically need help to do everything that I want them to do within an hour. So thinking that a hygienist is out on an island by themselves is a wrong way of looking at it. But nevertheless, probing depths are done, x-rays are done, panos are taken, and at this point, using the form that you can see now, I want the hygienist to walk the patient through a brief overview, and by brief I mean no more than 2 minutes. And this really is a checklist to teach the patient about what's going on in their mouth and to highlight any problems. So it goes a little bit like this, and I'll go a little bit quicker than I normally would, but as you can see on the form, it really is structured and anybody can do this. So, hi Tom, it's great to see you today. Maybe you've already taken the x-rays, maybe somebody else has taken the x-rays, but you get him in the chair. I want a greeting. I'm not trying to cut out any of the patient relation that needs to happen. So it's hi, how are you? A greeting, a handshake, a pat on the shoulder, pat on the leg. It's great to see you. I haven't seen you in a while. Or maybe they're a new patient and say, hey, how'd you find us? Where do you live? Don't worry, I'm going to take great care of you. Before we get started, the doctor wanted me to ask you a few questions. Is that okay? Now, when you say, is that okay, that's a real question. And one of the things that we're trying to teach patients is to respond and stay engaged. So it's important that you pause, that you wait for that answer to come back, because then it doesn't allow them to just drift off and think, oh, you're going to do your thing, I'm going to do mine. So doctor wanted me to ask you a few questions about your teeth today. Is that okay? Pause, wait for the answer. Do you have any sensitive to hot things like coffee, soups, or tea? Cold things like soda pop, ice cubes, cold water. Pressure when you bite down a tough piece of meat, hard piece of candy, or ice cubes, anything like that. Hot, cold pressure. Sweets, any candy, soda pop, sugary things that bother you anywhere? No. Okay, great. If they do say yes, then we want to magnify that. So any sensitivity to pressure? Yes. Where is it? How long has it bothered you? Would you describe it as stabbing or throbbing? And is it getting worse or better? I call those magnification questions. So for each category, hot, cold pressure, sweets, you have 3 examples that you want to use in each category, and then 3 magnification questions if they say yes. The whole point here is to get the patient to stop thinking this is just a routine cleaning and start thinking about the condition and status of their mouth. It may not be bothering them here today, but a month ago when they drank on something, they started noticing pain, and 2 weeks ago it came back and it got a little bit worse. Well, is it getting better or worse? It's getting worse. Okay, you may not get something today, but next visit you're laying the groundwork. Or, yes, this has been bothering me for a while. We want to make sure we take a look at it. So After you do the magnification questions, they say, yes, it's stabbing, it's been there for a couple of months and it's getting worse. You know what, when I'm done here, I'm going to take a couple intraoral pictures of that, and we'll make sure we bring it to doctor's attention. That's it. You don't have to diagnose it. You don't have to say, oh God, that's horrible, that's going to be a full mouth makeover. Nothing like that. Simply highlight, you know what, pain's not good, bleeding's not good, and educate the patient on what they have. Once that form is complete, and there's lots of other things in the form that we can go into, but the main thing I want to talk about today is just above the line, above the box, and that's hot, cold pressure suites and air. I call those opportunities. Every one of my clients tracks opportunities, and at the end of the week or the month, we know exactly how many hot, cold pressure suites and air came through the practice, and we do some great math with that, and we figure out exactly what our batting average is and how good we are at diagnosing and converting crowns. So I'll get into all that stuff later, but I want to focus on the one. Here's where it gets fun. After the cleaning's done, or whatever point you signal that you're ready for your exam, doctor comes into the operatory and he greets the patient. Hi, how you doing, Sally? It's great to see you. But he or she does not sit down in the hygiene chair. The hygienist, even if they went to get the doctor, should return to their chair, and that's super important. The doctor can stand here, he can chit-chat when he comes into the room, he should greet the patient, he should be pleasant, and at some point, he turns to you and says, bring me up to speed. And that's when you begin to tell him about the hot, cold pressure suites and air. Sally, you and I spoke, and you told me you didn't have any sensitivity to hot or cold, but you did have some sensitivity to pressure. It was in the upper right-hand side, kind of a stabbing pain, and it's getting kind of worse, not better, and we wanted to make sure we took away. I took a couple oral pictures of it, and here they are. We talked about that black ring that's around that old amalgam filling, and we just talked about a little bit how that was bothering you. Continue down through that list. The whole time you're making eye contact with the patient, not with the doctor. The doctor. So, doctor enters the room, hygienist sits down in their chair, doctor still has the positional authority, the patient is expecting him or her to say something, do that. Chat for 60 seconds. Chat for 2 minutes if you feel long-winded, but not 3, 4, or 5. We're in the hygiene chair and we got to keep it moving. After the doctor's done chit-chatting, he should turn to the hygienist and say, bring me up to speed. That is the cue for the hygienist to bring the doctor up to speed, all the while making eye contact with the patient. This is not a conversation for the doctor. It's a conversation for the patient to co-diagnose themselves. The doctor is simply the beneficiary of watching this occur. Yes, I have some sensitivity to pressure. No, I didn't have any sensitivity to hot or cold yet. Yes, sweets bothers me. Yes, we took an intraoral picture of it and we covered it. After you're done with that, you then turn to the doctor and say, doctor, I want to give it back to you for your full exam. At that point, the hygienist can get up, trade places with the doctor, and begin entering whatever the doctor exam results are. The doctor sits at the feet, wherever they have to sit to do the exam, completes the exam, asks if there's any questions. The doctor can exit the operatory. The hygienist takes the chair again and says, do you have any questions? Because they may be more likely to talk to the hygienist than it would be to challenge the belief of the doctor. That's just the way our world works. I'm not going to try to reinvent it. So that in a nutshell is the one-act play. But it is very tightly choreographed, and with my clients I work on where to stand and where to sit and the eye contact, and it's sometimes awkward when the doctor's standing there not to talk to the doctor about the findings. But it's not for the doctor. The doctor's going to do a full exam. It's for the patient to, again, get another experience of, yes, I understand what you said. Yes, I complained that this was bothering me. Yes, we looked at the intraoral picture. And when you're done saying that, doctor, we want to ask you for a full exam. So the hygienist isn't superseding the exam. The hygienist isn't jumping on the doctor and telling them exactly what they need. But it gives the doctor help. It gives the doctor a prepared patient where they're not the only bearer of bad news. Ideally, that patient is set up on a tee for that doctor to come in and hit a home run, or say, you know what, I think this can wait, but thank you so much for bringing it up. It definitely is. Looks like that amalgam is failing, but we definitely want to address that in the next visit. It allows the doctor to play the position of hero. So that's a nice caveat as well. He doesn't always have to be the bearer of bad news. But the one-act play, again, if it's done properly, if it's done consistently, has been one of the most important and impactful things over my 18 years of consulting and growing practices, that we get the entire staff engaged and helping the doctor find, diagnose, and convert dentistry. This, paired with a good tutor and transfer, can really result in an excellent patient experience and getting more dentistry on your schedule, booked and completed. I'm David, this is Perform. Thanks for spending a couple minutes with me. Take care. Have a good day.